A new study finds patients who stop taking weight loss medications like Ozempic and Wegovy regain about 60% of the weight they had lost. Some patients say they stopped taking it because of costs, and others say it's because of side effects. So obesity medicine Dr. Nita Bijoor is joining us now to break all of this down. She's triple board certified physician here at Oakview Medical Associates in Greenville. So thank you so much for being here today.
Thank you for having me.
I think this is a question that a lot of people have concerns about. You know, they start at a certain dose, then they ramp it up, and then they're like, I kind of want to try to come back down. So what did this study find?
So this study was a meta-analysis of 40 to 50 other studies, and they looked at people that were on either Zepbound or Wegovy, the weight loss GLP medications, and they followed the ones that had stopped the medication. So over a year, they found that about 60% of the weight loss was regained within a year. And then by computerized remodeling analysis, they have come to the conclusion that about 75% of the weight one loses can be regained once you stop these medications. So that's pretty significant.
Now, you've been able to help patients actually maintain weight while they're either coming down from them, microdosing, or even coming off of them. We actually interviewed a patient in the Wellness Files who was able to do that. Can you talk a little bit more about that? You can see a little bit of that segment right there where we got to sit down with this patient, hear his full story.
Yes, I think it's important to understand that biology doesn't lie, and each one of us is made up of different biology within. So one size fits all doesn't work in obesity medicine. It's a chronic condition. There are epigenetic factors that play a role. The ones that I divide my patients up into three broad categories. One is the ones that lose the weight and can keep it off long term. I can tell within a few months how they're doing if they incorporate very strong lifestyle, nutrition, physical activity, stress management, sleep hygiene, and getting off any toxins. Then they can maintain the weight loss. There's a second group that I find, those are patients that are on the medications, but the minute they miss a dose or on vacation or something, boom, 5-7 pounds comes back. So I already know that those are the ones I've got to really work on their metabolic adaptation. And the third group is, you know, they just can't get off the medication. If I do, I have to microdose them and slowly keep them on it long term, 6 months to a year. It's like any other chronic disease. If you had high blood pressure, you wouldn't just take a medication for 1 month and then stop the medicine. You have to be monitored and regulated because GLP medications work in 3 or 4 main physiological parameters. One is they reduce the hunger. Second is they slow the stomach emptying. And the third is that they lower insulin resistance. And the most important one is they change our metabolic signaling. That is the least understood part. Now, with changes in life, having a baby, having perimenopause, menopause, these are all big changes in our physiologic health where metabolism just crashes. So if we expect GLP meds to be the wonder drugs, I mean, it's one of the best things that our generation has seen because we're able to get 20 to 24% weight loss off. Nothing else has come even close to it. But in the long run, we have realized that about 5% of the weight is lost overall, which is still mighty,
Yeah, but so it's just figuring out how to maintain it if they want to come off of it. And if people want to listen to that full podcast episode, The Wellness Files, we do have it online on our website, YouTube, Spotify, and Apple Podcasts.